Welcome, everybody, to our next installation of the webinar series on the issues, approaches, and consequences of the COVID-19 crisis. I need to share the slides with you. We're having some technical difficulties, but hopefully Professor Rupert will be with us very soon. In the meantime, I would like to reintroduce you to some of our contact information. And hopefully at this point you see the photo of our webpage. We're keeping it well up to date. And we have Professor Rupert speaking today. We have next week on May 12th, some speakers addressing coping with change and attitudes towards social policies and persons related to the COVID-19 crisis. And some terrific presenters from the psychological and brain sciences department and the communication department. And we're looking forward to their comments next week. Just as a reminder, we have ways for you to stay in touch. The recordings from each session are up and running on YouTube. You can find the links there on our homepage about the seminar series. And we do have a Google group where you are very welcome to leave your email address, and we will send you weekly updates about the next speaker and topics as they develop. We're waiting for Professor Rupert to connect still.
He has signed on. I just need to make a change. So just give me yeah.
Sure. Professor Rupert is signing on and about to join us. It's my pleasure to tell you a few words about Peter Rupert, who we're very happy to have with us today. Professor Rupert is going to address economic aspects of the crisis, focusing particularly on labor markets during pandemics. Professor Rupert is very well known to the Santa Barbara community, very well known academically. In addition to being the former chair of Santa Barbara's economics department, he remains the executive director of the UCSB Economic Forecast Project, which brings in academics, government officials, and business leaders from throughout our area. He's also associate director of the UCSB Laboratory for Aggregate Economics and Finance. He's an editor of 2 academic journals, and before coming to UCSB, spent a number of years as a senior economic advisor to the Federal Reserve Bank of Cleveland. He has a number of areas of expertise and is always an engaging speaker, and we are glad to have him with us today. I will take this slide away and turn over the floor to Professor Rupert. Thank you for joining us today.
Thank you, Peter.
Thank you very much for inviting me to do this. I am going to share my screen, I guess. Is that okay?
Yes, please do that.
Got it. Okay. Can you see that?
Yes, we can.
Got it. Okay, thanks everybody. As everyone knows, this is a pretty much unprecedented time. We know how unprecedented it is in terms of the pandemic, but we should be a little bit careful when we look at this stuff, because right now, as I say here, how little we actually do know. And this is, you can see here, this is safeguard our patients during the present flu epidemic. This hospital has restricted all visitors until further notice. The outbreak started in China, where it quickly engulfed the city of Wuhan before racing across the globe on commercial flights. And it's killed over 100,000 people in the US. This was in 1968. This is basically a pandemic that killed over 100,000 people, more than 1 million people in the world. And as I say here in my talk, how little we know and how much we've forgotten. And just to let you know how people responded, this is a picture of Woodstock in 1969. There was no shutdown. As everyone knows how many people were at Woodstock. And this article from basically from the Wall Street Journal goes back and lets people know that this epidemic, this pandemic, lasted about 3 years. And so one of the lessons we need to know is to look at how these things can respread. So if you look at this graph, this basically shows that the first pandemic in 1968 to 1969 is in the salmon color, and then the black is the second wave that occurred. And this is kind of the concern that many of us are facing today. And so when I talk about how little we know very little, at the end of the day, and I think many scientists will argue with me, but I'm going to show a couple things here to maybe let you know that we don't know very much. And we certainly don't understand much of the economics. We've actually never been in a situation like this before. This is really not like a standard recession where it might hit the housing market. It might be about aggregate demand when the Fed can come in and generate some reasons to consume more. I'd like to consume more. There aren't any stores open, right? So it's not like, and we don't have jobs. It's not, so the government is not going to be able to spend trillions of dollars, $1.5 trillion in 2 months, or $1 trillion a month, roughly. That can't happen very long in an economy. So right now, my point is that we're making a lot of decisions from best guesses. We're trying as best we can under these circumstances, but as everyone knows, we don't even know when we're going to open. We're talking about opening. I just showed you a picture that basically said that this thing can happen again. We can have a second wave of this, which I think is what people are pretty concerned about. But you should go back and look at that. By the way, the slides will be available, and all these are linkable. As many of you know, there was a test in Los Angeles 2 weeks ago, 3 weeks ago in Santa Clara, done by a group of physicians and scientists who basically said that the number of people who actually had the infection, had the infection, was somewhere between 250,000 and 500,000. And as scientists, if we give people ranges like that, it's like, boy, you guys don't really know very much, do you? You're saying it could be double 250 or double that. So again, it's very hard. And then something we probably won't get to, and I'd like to open this up at some point, maybe to another discussion. Where's all the flour, and where's the yeast, and where's the toilet paper? We don't have any. You go to the store, and the shelves are bare. And one would wonder how, in a country like the United States, the shelves would be bare. This has a lot to do with what happens during emergencies, during price gouging. And again, I'm very happy to talk about that if at some point, if someone wants to bring that up. Not sure I'll have time today. So here's what I mean about how little we know about the science. And the science, this is about a month ago, a little more than a month ago. This was Anthony Fauci, who many of us never heard about until now he's become a celebrity. Anthony Fauci said, the flu has a mortality rate of 0.1%. This, meaning COVID-19, has a mortality rate 10 times that. So what does this mean to us? I mean, 10 times, 0.1% being 1%. I mean, if one out of 100 people die from this, this is a very, very serious, pandemic, and something that really has to be stopped very, very quickly. If it's 0.1%, then it's 1 out of 1,000 people are dying. And then maybe the policy prescriptions that we come up with would be very, very different if it was 0.1% versus 1%. This is Dr. Jay Bhattacharya from Stanford. He was one of the people that did the Santa Clara study as well as the LA study. And he says an epidemic seed, so we used a standard epidemic model, simulated it. An epidemic seed on January 1st implies that by March 9th, about 6 million people in the US would have been infected. As of March 23rd, there were 499 deaths. So you can see how fast this has really happened in the US. That's a mortality rate of 0.01%. So here's Dr. Fauci saying it's 0.1%, and here's Bhattacharya saying it's 0.01%. This is off by a lot, right? So here's our kind of two top scientists not even knowing where we are. And obviously, to do this, we need a lot of testing. We have to understand how many people have it. And without testing, we're just pretty much in the dark. We're just guessing. So this is an important step. And when I'm going to talk about the economics today, I'm not trying to make light of fatality or mortality rates. Obviously, this is very important. But what I want to just caution us all, and again, I'm not in this field, but I think there's been a lot of work written on something called the depths of despair. When individuals lose their job, they basically have nowhere to go. They become depressed. They possibly get addicted to various drugs, alcohol. We've seen opioid addictions, suicides go up, etc. And I think I just heard recently that the suicide hotline in LA has increased calls by about 800%. So these things, when we talk about lives, I think we have to think more broadly. The virus is going to kill people. There's no doubt about that. It's been happening. But so is it if we just let people not be able to have a good life and healthy life. So anyway, like I said, the science, it's not so good out there, though we're learning a lot more. Economics, well, this morning it came out the Treasury is going to borrow $3 trillion in the second quarter of 2020. This is serious money, right? The GDP in the United States is about 20 trillion. So, this is a big number to borrow in a quarter. And to think it's not going to matter, I think people are mistaken. This is borrowing. This is going to have to be paid back. This is not, something that just falls from the sky, even though many people hope that the Federal Reserve can just print a bunch of money. That's not really going to happen. This number, 3 trillion in the second quarter, was about 5 times more than any quarterly borrowing during the Great Recession. So this number is just massive compared to what happened to the Great Recession. I just looked at the Treasury receipts, the US Treasury receipts this morning. April, year over year, that is this April versus April 2019, Treasury receipts are down 78%. Obvious. They delayed the tax. So given that we're not going to pay taxes April 15th, you can see that the Treasury's receiving very, very little money and spending a lot of money. So this is going to haunt us for a while, no doubt about that. And the economics also is all over the map. And as I mentioned, just like scientists aren't quite sure what the mortality rate is of this disease, we're not quite sure what's going to be the repercussions from this pandemic. Why do I say that? Here's 2 groups of people. Economic Policy Institute. The Economic Policy Institute projected back in beginning of March that the United States would lose about 19.8 million jobs. Well, we've already blown through that if you look at initial claims, which I'll show you in a second. The St. Louis Fed, on the other hand, looked at 2 different studies, and they took an average, and they believe that there would be 47 million Americans who would lose their jobs because of this pandemic by June 1st. And when they estimated the unemployment rate from their different scenarios, they came up with unemployment rates somewhere between 10 and 40%. Again, that's a huge range. If my students came and said, I got some data, I did this, it's between 10 and 40%, I would say work a little harder. But it's just because we don't know. We're just making guesses. By the way, just as a reminder, the unemployment rate during the peak of the Great Recession was just over 10%, and the unemployment rate during the Great Depression was about 25%. The difference is, in the Great Depression, back in the 1920s and 30s, the unemployment rate stayed close to 25% for almost 10 years. So that was just a very devastating event. As of February 1st in the United States, there were about 5.8 million people unemployed. And now if you look a couple lines up, you'll see that the St. Louis Fed is projecting 47 million people might lose their jobs and go into unemployment. We've already seen some effects of this, and just like many scientists, epidemiologists are saying we need to flatten the curve, I've been saying for a while we need to flatten the economic curve. That is, we have to be very careful about how we do this. And everybody's talking about opening. So the government came in with a sledgehammer. They basically shut everything down. In terms of reopening, the government cannot actually do anything about reopening. If tomorrow the government said all jobs are open, all businesses are open, very few of us would get on an airplane. Very few of us would go to a movie. Very few of us would go to a restaurant. So what's going to happen is it's not going to be the government that's going to open up our economy. It's going to be consumers. And what that means is that all businesses have to realize how to open up in a virus-safe way. And if you walk up to a store, you're going to get a manicure, or you get your hair done, or whatever you're going to do, you're going to make sure that those people have all the precautions necessary for you to feel safe. And if you're not safe, you're not going in. So, you know, this is going to be and continue for a while. So we've already seen some unprecedented effects. Many industries hit harder than others. I'm going to try to go from the national to the local level a little bit, just to explain a little bit, because we know more about Santa Barbara than other places. So really try to drive this home. So this is a picture just of April. This was the from the Bureau of Labor Statistics, the leisure and hospitality employment change. This came out in April for March, and we're going to have another reading this Friday from the Bureau of Labor Statistics. But you can see in March, leisure and hospitality employment fell by 459,000 workers. And obviously, these are the first hit. Why are they the first hit? These are the easiest in some sense to close. These are restaurants, hotels, bars. Many hotels were not forced to close, by the way. They closed on their own because no one would come. So this is mainly bars and restaurants and retail workers, et cetera. Hotel employees, et cetera. So 459,000 lost in 1 month. You can see what it looked like before. Tiny numbers, maybe 23,000, maybe it goes up 70,000 during the summer, et cetera. I mentioned initial claims. So this is a strange graph to look at. You'll see that going back to the 1960s, these are initial claims. So what are initial claims? When you become unemployed, you go to your state unemployment insurance system and you file for unemployment insurance. That's called an initial claim. Then if you stay unemployed for 1 week, you would move into another category called continued claims. So what initial claims are, and by the way, not everybody who claims economics, unemployment insurance gets it. These are people who apply for it. They may or may not get it, but you can see what this has looked like. Let me go back just a couple of months and show you what this looks like. So you can see going back before March 14th, these numbers were like 200-some thousand. Again, every month going back in history over the last few years, it would look like 200-some thousand. All of a sudden, March, the week ending March 21st, there were 3.3 million people applying for unemployment insurance. The next week, another 6.8 million. The next week, another 6.6, 5.3, 4.4, 3.8. So you just add up those numbers, and we're up to 20-some million, 26 million people applied for unemployment insurance. So, you know, what this basically means is that we've already blown through that number I just told you about for the Economic Policy Institute. We now are up to about 26-some million people who have applied for initial claims. This is advanced retail sales. This is percentage changes. So you can see going back, the blue bars, by the way, are recessions. And so going back to the 1990s when this first came, the data was available, these are advanced retail sales. Again, this is for March. You can see what happened. Retail sales fell by 8.7%. During the Great Recession, at the bottom of the Great Recession, it only fell by about 4%. So again, this has just devastated our retail sector as well as the leisure and hospitality sector. So here's some interesting stuff that I think that we should all, look into and see how we can use a bunch of different methods to try to get a sense of what's happening. And this comes from a company called SafeGraph, and SafeGraph is a company that works with Google, Apple, and individuals who have cell phones, and the people who have cell phones allow them to go ahead and use their cell phones to track where they are. So now you can see what happened. And by the way, so we got the data at the Forecast Project. We downloaded it for Santa Barbara. This is for the city of Santa Barbara. So what you can see is going back January 2019, for example, these are hotels. We all know that during the summer, hotels increase. Then they start to decrease. Then what happened during February, March, now you can see that hotels, foot traffic has gone from about 6,000 per week to, less than 2,000. And by the way, this was just for last a month and a half ago. So it's going to be even farther. And you can see this is nature parks, similar institutions. This dashed line is the statewide shutdown by the governor. So this is different places in Santa Barbara. I probably should tell you guys, I'm actually the chief economist for the Santa Barbara Zoo, in case you wanted to know. We can talk later about what economists do for the zoo, but you can see in red is the Santa Barbara Zoo. Santa Barbara Zoo, again, rises during the summer, falls during the fall, and then you can see it's basically gone to zero. The blue is the Moxie Museum, basically has gone to zero. All these places that we used to go to, basically I see no foot traffic. These are types of establishments. The blue is hardware stores. It's fallen the least. Why is that? Well, everybody's home, realizing now they have cracks in their walls. They go buy paint. They go fix things. There's nothing else to do. It's fallen. These are movie theaters. I mentioned earlier, who's going to go to a movie theater during this time period? Any place where congregation is necessary for the business to work. Obviously, we're going to have nothing going on there. And again, whether movie theaters open up or not in their current state, it's going to be hard to tell some of the changes that may have to happen going through movie theaters. These are full service restaurants, snack and alcoholic beverage bars, and limited service restaurants. So what's fallen the most? Well, you can see that full service restaurants, basically they're shut down. Some of them have been able to switch over from full service to takeout. That's very, very difficult for restaurants to do, actually, if they didn't do it before. And I can tell you that many restaurants in Santa Barbara, for example, the Lark, the owner Sherry, she tried takeout for a few weeks and was losing money every week and just said, forget it, we just can't do takeout. That's not where our business is. She told me that they went from an annual revenues of about 17 million over the last few years, 17 million per year, and it's been zero since March. So these restaurants, bars, clothing stores are being hit incredibly hard. And again, some of the ideas they have for reopening just won't work. For example, many people have said, hey, restaurants, you need to have more social distancing. So if you're going to open, you need to have half the number of seats or a third of the number of seats. If you talk to any restaurant owner, they'll tell you they were barely making it at full capacity. They're very thin margins, very, very difficult. Many people around town are suggesting that something like a third of the restaurants that we used to know will be closed, maybe as many retail shops. I just heard of another one the other day, Plum Goods in Santa Barbara. Amy Cooper, the owner, she has basically decided just to close shop forever. She said she just can't muddle through this. So it's going to be very, very difficult as we come back. This is different types of stores. These are grocery stores. I have no idea what happened to Whole Foods, why people started going to Whole Foods, and I just don't have any idea. But in any event, you can see that all of them have fallen a lot in terms of foot traffic. Many people are switching to takeout. That's for the whole county. These are types of stores. Again, Starbucks decided they were going to close, even though they could. They're open for drive-through, but you can see Starbucks foot traffic basically has cut in half. McDonald's foot traffic cut in half. All these places have cut in half. And so the question is, how are these places going to reopen, and by what method are they going to reopen? I had to do this. These are some of my favorite places: breweries and wineries, not dispensaries. I don't go there, but beer, wine, and liquor stores. So what you can see is wineries. Basically, all the wineries are shut down. The reason people go there now is just to pick up some stuff. No one's going there to visit. So now let's look at some projections. And what I'm going to do here is I'm going to take some of those numbers that I presented before from the Economic Policy Institute, and then take some of the numbers from the St. Louis Fed, and I'm going to try to apply them to us, to Santa Barbara and the state. And what I'm going to do is I'm going to suppose that the numbers they're talking about, I'm going to say it's kind of symmetric, that we're going to see about the same percentage loss in Santa Barbara. And I'm going to do it for basically two things: leisure and hospitality and retail. Those are the two big hits that I just showed you earlier. So this table, so the upper part of this table And you can see here, it says 19.8 million EPI. That's from the Economic Policy Institute. This is what they guessed starting in February 2020, how many jobs would be lost by June 1st. And you can see it's 19 million. So what I'm going to do is I'm going to look at private sector jobs. So private sector jobs, for example, in Santa Barbara was about 150,000. Government's big here, but I'm just going to look at private sector for a second. Of that 150,000, about 28,000 were in leisure and hospitality, 18,700 in retail. So if we go by the losses that the Economic Policy Institute was talking about, the private loss out of 150,000 workers was going to be about 23,000 workers would lose their job. Again, I mentioned before, 23,000 workers in Santa Barbara County losing their job is a huge number, and I'll show you that in a second. Leisure and hospitality would lose about 11,000, and retail would lose about 7,200. So now let's go to the bottom part of this table, which is the 47 million number, which we're inching up toward, as I mentioned. Again, private sector jobs in Santa Barbara County, 149,400. If we see the US losing 47 million jobs, we can expect about 55,000 jobs lost, 55,000 jobs lost in the private sector in Santa Barbara alone. What does that mean? Well, you can see it's a third. If all these people lose their job in the private sector, we're losing about 54,000 out of 150,000, and they all go into unemployment. That's nearing a 30% unemployment rate, at least 25%. That's Great Depression territory. Leisure and hospitality would lose about 26,000, and retail about 17,000. So again, these are massive declines that an economy like Santa Barbara has, or any economy has ever seen before. Now what I'm going to do is I'm going to take those numbers and I'm going to try to project a little bit about what might happen. I'm going to do this in the Tri-County area. Santa Barbara County is the blue. The reason these slopes are different has to do with the size of the population, the size of the workforce. It's not like the green line is better in some sense than anybody else. It's just they have more employment. So what I'm going to look at is I'm going to say, okay, let's go back to the Economic Policy Institute, 19.8 million jobs lost in the US. I mentioned before that take the blue line, Santa Barbara County, we'd lose about 25,000 jobs, 23,000 something jobs. If we lost 23,000 jobs in the current environment, go up this dashed line, hit this projection line, and you'll see that we're going to be slightly over a 15% unemployment rate by June 1st. Currently, the unemployment rate in Santa Barbara County as of last month was 3.7%. And there were 7,900 people unemployed. I just told you if all those people who I just mentioned lose their job, that's 24,000 people losing their job. The number of unemployed would go to 24,000. I mentioned flattening the curve. Yesterday, it was announced that California is the first state to ask the federal government for help for unemployment insurance. Our unemployment insurance system is cashed out. There's nothing they can do. They can't get to all the people who are needing unemployment insurance. So they had to borrow money from the federal government, first time ever. Now, if we go even farther and look at this St. Louis Fed prediction of 47 million, again, go to the blue line. This is Santa Barbara County. I mentioned there would be about 54,000 jobs lost. That's here. If 54,000 jobs are lost in Santa Barbara County, that translates to about a 30% unemployment rate. And by the way, that number, 30%, is a number that the president of the Federal Reserve Bank of St. Louis had kicked around a few months ago, saying we could be headed for 30% unemployment rate. Okay, so that's what that's what we've been seeing, and so that's kind of the data that we're looking at. And now what I'd like to do is I'm going to talk a little bit about a paper I'm just working on now, which is about labor markets and the pandemic. But first, I'll show you. So this is, now you can see how nice my website is. So if you just go to the research page, again, you'll have the link. You'll be able to see this paper. But now let me go to it and talk a little bit about what's going on in this paper and what predictions this paper would have. So this paper is called Labor Markets During Pandemics. It's joined with a former colleague from UCSB, Marek Kopishka. And we know that this disease has pretty much disrupted every facet of life: healthcare, travel, leisure, hospitality, retail. The focus of this paper is going to be on labor markets and some things that the model would want our economy to do, which looks similar to actually some of the things we are doing. So what's going to happen here? So a couple of things are going to happen to labor markets. There's going to be a direct effect. And obviously, the direct effect is going to be those people who are infected with symptoms, who are sick, they're not going to be at work. And then people are going to die as well. And both of those things are going to reduce people at work. There's going to be a lot of indirect effects as well. These indirect effects, basically, are going to be coming from the fact that being outside at work, traveling to work, seeing other people is going to have a larger effect in terms of the reproduction rate than if you're just staying home. So the assumption in this paper is going to be basically that if people are employed, there's going to be more social interaction at work, and therefore they're going to have a higher chance of either getting the disease or transmitting the virus as well. So what is that going to mean? Well, if I know that I'm working at a job and I have a chance to get a virus now, and and the more people are infected, the more likely it's going to be, I'm going to be less willing to participate in the labor market. I'm going to say, wait a minute, I'm not sure I want to go to work right now. And so to entice me to get to work, either firms are going to have to make sure that I'm safe, or they're going to have to pay me more. In this sense, employment here is going to create what economists call a negative externality. This negative externality means I'm going to take into account the fact that if I go to work and there's other people around me working, I could get sick with a higher probability if I just stayed at home. I'm going to make that conscious decision whether I go to work or not. However, I'm not going to necessarily, and probably not, take into account if I go to work and I have the disease, but I'm not, I'm asymptomatic, I could be giving it to others. I'm not going to take their getting sick and losing work. I'm not going to take that into account as I decide whether or not I wanted to participate in the labor market. Of course, we wish people would, but typically they do not. And so we have to somehow incentivize people to do what I just said, to be willing to say, you know what, I should just stay home. Because if I go out in the marketplace, I'm just going to affect other people. So that's what we mean by a negative externality. Negative externality in economics is simply, I am not going to take into account some effects that I have on others. And we know many examples of this. For example, pollution is one of the biggest ones. We know how to deal with firms. They decide they're going to operate. Left to their own devices, they could pollute the air, they could pollute the rivers. And so we have to go in because basically the private market has a very hard time solving externality problems. That is, we could all go to this firm as local residents and say, listen, we think you're polluting too much. Could you please not pollute so much? And they would be like, no, just go away. Reduce my profits if I do anything. So we could figure out a way to contract. We could raise some money to get them to pollute a little bit less. We could buy them out. We could do all kinds of things, but it's very, very difficult to do to get that kind of organization. So typically the way governments and societies deal with externalities, I'm going to talk about a negative externality like pollution, is to tax it. And taxing an externality means that we try to get the private cost of production, that is, how much it costs this firm to produce a good they're producing, equal to the social cost. The private cost is their own internal cost of producing a good. The social cost is the cost that is the total cost from them plus any additional costs on society. And with pollution, it could be, air quality, river quality, etc. So what happens is a government comes in and says, listen, we think we know what society has decided about how much pollution, how much CO2 emissions you're emitting. And when we do that, we know that the world doesn't want you to shut down completely because we need your products. So we're going to have to make a choice. And that choice is going to be how much pollution at what cost. Given they make that choice, they put on a tax, which is called, it comes from an economist named Pigou. This is called Pigouvian taxes. And what they're going to do is they're going to put a tax on this business such that they produce less. What does that mean to produce less? It means to make sure that the cost of their own private cost is the same as the social cost. That is, we're adding an extra cost to them of cleaning up the environment, for example. Do we see a carbon tax in the US at the moment? No. Almost every economist I know believes that the way to solve the externality of pollution, CO2 emissions, is you just tax it. Many models out there, they kind of have a sense of what the tax rate should be, but I can tell you again, this is not exact. I've seen numbers between $40 a ton of CO2 emissions up to $150 a ton. And again, it depends on what your assumptions are in the model. Okay, but so what we're going to have to do here is we're going to have to solve this externality. And again, the externality here is that my actions might affect others, and I don't take that into account. So what we're going to do in this paper, we're going to take the standard model, the SIR model. So the SIR model goes back to 1927, Kermack and McKendrick, and I think all of us are aware of it now. And basically the SIR model, by the way, SIR stands for susceptible, infected, and recovered. It's a great model to study infectious diseases and spreads if we have the data. However, it's not so useful to understand labor markets. And we want to think that labor markets are out there, and there's a lot of social interaction, and so they're going to have some effect on labor markets. And they're not very useful to study optimal policy responses when we include the economy. Obviously, if our only care was to reduce deaths, and we don't care about the economy, that's going to be a certain set of policies. If, on the other hand, we also have to have people earning a living, getting back to work, that's going to be a different set of policy responses. So there's going to be some technical stuff here. I'm not going to really talk about it. This is going to be a very standard model of the labor market. It comes from two Nobel Prize winners of a few years ago, Dale Mortensen and Chris Pissarides. So we're going to take that standard labor market model, and we're going to add on to it an SIR model for the disease spread. And again, we're going to have people in different stages. They're going to be susceptible, and then if they're susceptible, they can get infected. And if they're infected, then they can either recover or they die. We're going to assume here that basically, if people get it and they recover, they're going to be immune. And they're not going to be able to spread it to others, and they're not going to get a recurrence. Obviously, we don't really know this yet, but that's the assumption that's here. And the idea being that the probability of getting infected is going to depend on how many people are infected relative to how many people are susceptible. The more people are infected means it's going to be easier for me to catch the disease. The fewer people are infected, the more difficult. So now, as I said, if there are very, very few people infected, I may feel perfectly fine about going to work. As the pandemic spreads week by week, as we've seen it, infecting more people, killing more people, I start becoming more worried about going to work. And again, remember, if I have the disease, I could spread it, and I'm not going to take that into account. So what this means is, because of this externality, the virus externality, the labor market is not going to function efficiently. What do I mean by that? Well, I have it technically here, but what it really means is that we don't want firms to be opening jobs and hiring people if it's going to increase the spread of the disease. So somehow we have to stop people from deciding to go to work in this environment without proper testing, et cetera. So the paper is going to talk about how labor markets are going to react in terms of wages and unemployment rates. How can we use the labor market to reduce these externalities from the disease? And what is the optimal policy response? So it's going to turn out in our model, and we wrote this, a month and a half ago or something. That's when we started working on it. One of the policy responses coming out of our model is to predict that you should stop people from going to work. You should let output in some areas go to zero. Other people have worked a lot on this now. What's really funny is typically in academics, we know that it takes years to write papers. Everybody and their brother and their mother are now writing, COVID economics papers, and hundreds of them have come out in the last 3 weeks. So I wonder why they were all so lazy before. But anyway, so this is why I think a lot of people don't like economists very much, and why it's called the dismal science. I mean, by the way, it's not called the dismal science because it's boring. It's not boring, actually. It's called the dismal science because of Thomas Malthus, who basically predicted that we'd always live at the lowest level of existence. But so what's going to be the optimal policy response? Well, as I said, the model is going to want us to reduce people going to work. And the reason, again, is that going to work is going to increase the spread. And there's a crazy thing. If you remember, I mentioned this thing called the Pigouvian tax, that you tax externalities to make the private market equal the private value of the social value. So what this model wants is what's called an infection tax. I know this seems horrible, and this is why people don't like economists. I mean, so, what's an infection tax? An infection tax is some poor person who's infected is on a respirator. We now go in and give them a higher tax bill. So why are we going to do that? We're going to do that to prevent them from getting infected in the first place. How are we going to do that? We're going to make it more costly for them to go to work and possibly infect themselves and others. Of course, we're not going to do this, right? I mean, this is, that's why I put implementation here. Obviously, implementing this policy, we're just not going to see it. So we're going to have to think of another way to basically stop this from happening. And there may be many ways to do this. So what's going to happen? So what's going to happen in this world is that there's going to be two effects on the wages of susceptible people. And what this paper is asking for, and by the way, it's only going to work if there's adequate testing. What our paper is asking for is to be able to separate the labor market into two parts, a recovered part and a susceptible part. And by the way, some of you may have known this movie from 2011 called Epidemic. That movie, Epidemic, they finally figured out testing. It was a pandemic, but people who got tested for antibodies and they were no longer infected with the disease nor could spread it, they were given a badge or a yellow armband or stamped on their forehead or something, that they no longer carry the disease and they can't get the disease, they can't spread it. So this is what our model is going to want. Our model is going to want a mechanism to test people whether or not they've had the disease and recovered. Obviously here, we're going to have to make some assumptions about what it means to be asymptomatic. If maybe you have the disease and don't know it, you don't get any symptoms, but you can spread it. That's a detail that I'm not going to talk about here. So what it's going to do, it's going to say, look, I'm not going to go to work unless they pay me more. And why is that? Not only do I have to go to work and work hard, there's some chance I get infected. So what it means is during the pandemic, the higher the chance of me getting infected, the higher is going to be my what's called reservation wage, which means the wage I'd be willing to accept to go to work. The other thing that's going to happen in this world, and that's going to be going up, that reservation wage. The other thing that's happening at firms is the value of having an employee in a matched job falls. Why is that? Well, I know that if someone's not recovered, then I know that they could get the disease. And if I hire them and they start to work for me, I do some training, and then they get the disease, they're infected, maybe they can't work, maybe they die, then the value of that match falls. And so what's going to happen as the pandemic moves forward week by week, these two things are going to fight against one another. First, wages are going to fall, and then wages are going to rise as you recover. So this is a strange thing in this model, but that's what it's going to do. So what are we going to find here? We're going to find that if we could separate the market into susceptible workers, that is, you get tested when you walk in the door. Have you had the disease or not? Are you currently infected? And we're going to look at recovered workers. So we'll have a test that says workers are recovered. So our model really wants testing. There's no doubt about it, as the world does. Why we don't have it in Santa Barbara yet? Bit of a question. I mean, in LA, they said that anyone who wants to be tested can be tested for free. It's not so easy, I found out. I just wanted to see if that was true. Kind of hard to get an appointment. But in any event, we want testing. So what's going to happen is that individuals who are susceptible are going to find that their unemployment rate goes up. And it goes up substantially. And the reason is that no firm wants to hire a susceptible worker. Why not? Well, the match could end. And so they're very, very reluctant to hire someone who's susceptible. On the other hand, they're very willing to open them jobs for recovered workers. And we're going to find in the model, their unemployment rate falls. What do we find? Well, we find that in the model, when we simulate the model to real US data, we find that the total unemployment rate is going to rise by 10% if there's no government intervention. If there's government intervention where the government can come in and quarantine workers, can shut down businesses, then the unemployment rate is going to rise to 35% with the quarantine. And as I mentioned, that's a number that's not out of the realm of what people are predicting for what's going to happen by June 1st. Okay, so again, during the pandemic, as I mentioned before, there's this notion of externality. Well, for firms, they're still willing to hire people. It's going to fall, but it's still going to be above zero. So they're still going to be hiring people because there's still some positive surplus they're going to get from this match. That is, the output of the match is going to be greater than the wage they have to pay. This is the problem. We don't want private firms to be opening vacancies to hire workers because that's going to spread the disease. The social value of a match, and I mentioned this private versus social aspect before, the social value of a match, however, goes negative. That is, once the pandemic is high enough, it's going to say that there's such a high chance of other people getting infected by you or you getting infected, the cost is too high. And so a government, we call it a planner here, someone who's going to plan out what the economy should look like, wants to move people out of employment. They want to shut down businesses. That's what they want to do. How many people do they want to remove? They want to remove about a quarter of the people. And as I mentioned, we're already getting in those areas where we're removing individuals as it is. So I'm not going to go through all the math. I'm just going to skip all this crazy math. You don't care about that. So let me talk about the dynamics a little bit. So the dynamics are such that here's how we're going to start the world. So the initial steady state of this economy is going to be where the infection, the number of people infected is 0. That's I. And the number of people dead because of the virus is 0. What that means is that when we start this economy, everyone's just susceptible. So go back to January 1st, for example, when people think maybe the virus first came to the US or something like that. No one had it, and no one was dead from it yet. We're all susceptible. And then we're going to say on January 1st, for example, we're going to just give a small fraction of the population the virus. And then we're going to use the SIR model to trace out the spread of the virus and the disease through the economy, and then see how that affects those things that I mentioned before. The final steady state, so we're going to go through all the dynamics, and in the final steady state, again, no one's infected, the virus is gone, but some people have died. So that's going to be the final steady state. No one's going to be susceptible anymore once we've gotten rid of it, a vaccine perhaps. So this is what the model wants to generate. And the model generates the following from the SIR model, given the data that we supplied to the model. So if the blue line is the unemployment rate, the probability of being infected if you're employed. And you can see it peaks at about 28 weeks at about 6%. So the virus started back here at time 0. Very few people were being infected at time 0. We can see the spread of the virus. At 28 weeks, it peaks, it starts to fall, and then by about 60 weeks, about a year, a little over a year, the effects are almost gone. About 6% of the population, the probability of getting infected is about 6% at that point. Now, if you look at unemployed people, they have fewer social interactions, therefore, they get, the disease is less. And the disease is less because what we've done here is, in this particular case, I don't want that. In this particular case, what we've done is we've said that the probability of getting infected if you're unemployed versus employed is basically you're half as likely to get infected if you're unemployed versus employed. And that's why we see this, the probability of getting infected if you're unemployed about half the height of this. So again, I mentioned these two things. The two things I mentioned were about the value of the match, and the value of the match, again, was how valuable it is to have a matched worker. This part here, it's actually how many vacancies they're creating. So what's going to happen is this. As I mentioned before, the value of a match for recovered people does not change. That's this yellow line. So why is that? They're recovered. They're not going to get the disease. So the value of the match stays constant. Infected people, they've already been infected. The value of their match is lower because they're not working right now, but that doesn't change because they recover. What does change is susceptible workers. If I'm trying to hire susceptible workers, as the pandemic gets worse and worse, and this outlines pretty closely what you saw here in terms of the spread of the virus. So this is negatively the mirror image of that spread, except for one thing. This one thing is very interesting, I think, that this bottom here, this is when firms stop opening vacancies. They're like, it's not worth it for us anymore to open vacancies. That happens at 25 weeks, where the peak of the virus was at 28 weeks. And the reason is workers are forward-looking. They're forward-looking to say, hey, this thing is still getting bad, and I'm really not ready to go to work until I start to see things getting better. And so before even the pandemic hits its peak, firms have already started stopping vacancies, and that's this graph on the right. So wages again, I'm running out of a little bit of time, but wages again, this is what I meant before, that there's this difference between susceptible workers and recovered workers. Susceptible workers, two things were happening, as I mentioned. The value of the match was falling, and then all of a sudden workers are like, the pandemic is raging, I'm not going to go to work unless I get a high wage rate. And so the workers who end up getting higher wages, but then it falls back to our control. And this orange line is the match surplus, which is the value of a match again. So again, the point of this paper is segmenting the market is going to help a lot. Unemployment rate, I've already mentioned a little bit. This is the overall unemployment rate, as you can see, the blue line. This is the unemployment rate for susceptible people. No vacancies are out there for them. They can't find jobs, therefore their unemployment rate's high. Everybody wants to hire a recovered worker, and so the recovered worker's unemployment rate falls, and then gets kind of back to steady state. So again, what would a social planner do? As I mentioned, a social planner takes this externality into account. And by social planner, I mean a government, for example. If it's possible to, the planner would like to destroy matches. And by the way, I mentioned that the planner wants to destroy about 25% of all matches. What that means is if they destroy those matches, about 10% more of the population is not going to be infected. So what the planner cares about is this infection rate, as well as how much output there is in the economy. And again, if the planner can do this, if the government can shut down businesses, this panel on the right-hand side, panel B, is what's going to happen to the unemployment rate. So if this yellow line is the efficient outcome in this world where we have shut down businesses, we've removed people from employment, the unemployment rate goes up to 35%. If the government can't actually remove people, it only goes up to 15%. We're in an environment today where we're looking at the government can remove people from work, which they've done, and we're heading up towards a much higher unemployment rate. What does this do to the fraction of people getting infected? Well, you can see on the left panel, if we can remove people from the labor force, keep them at home, quarantine, we lose about 10% fewer people get infected, and not as many people die. That's on panel B. So that's kind of what's going on here. Again, I mentioned this this tax because somehow we have to get here. So quarantining works, but we can even do better than that if we somehow put this tax on infected people. Again, not going to happen. So then what are we thinking of doing? We're thinking of taxing businesses on vacancy. So basically what we want to do is we want to stop businesses from hiring people. We want to say, look, you have a person right now that you're thinking of, forget it. If we do both of these things, quarantine workers, tax vacancy creation, we can implement the first best, which basically is this yellow line. And first best means the fewest deaths given what's happening, where we keep some of the economy open. So that's the paper. I mean, again, we took a standard labor market model. We added this SIR epidemic model into it. Our model predicts that we would want the labor market to separate into two. If it cannot, if we can't tell who's infected or not, then we're somewhere in between those cases I showed you. We're just going to be guessing whether someone's infected or not. And so we're going to get the infection to spread more deaths, higher, but lower unemployment rates because those people, we just don't know. So what we need is a quarantine and some kind of tax on either infections or vacancy creation. And that's it. It's pretty much right on time, I think.
Thank you very much, Peter. That was a fascinating description. We've all been hoping that the COVID virus doesn't affect us individually, but the economy is affecting all of us, no matter where we are. I'm sorry we don't have time for the Q&A today, but I appreciate the wonderful lecture, and I look forward to everybody coming back to join us next week. Thanks so much for joining us.
Good.
Bye-bye.
Thanks for going over, Joe. I'm sorry for going over.
Thank you.
Okay.
Bye.